All right, hello there. Dr. Jarrod Frydman, Chief Medical Officer, Prime Care VIP. I'm here to talk to you today about a couple of important medical tips and information. So first, my passion, diet and exercise. Why? Because I think it's the mainstay of keeping us healthy, keeping us balanced, and keeping us off medications. Unfortunately, too many people are prescribed medications that may have been not necessarily avoided, but or prolonged if they would have undertaken more of a proactive stance with diet and exercise. What do I mean about that? It's not just about eating healthy. It's about what's coming in. How much is coming in? How much is coming out? What are we eating? How much of our diet consists of fat? What is our percentage of saturated fat? Current recommendations are below 10%. We're really trying to get below 5% saturated fat. Why? Because it's going to reduce your overall risk of cardiovascular disease. When we talk about cardiovascular disease, it's the number one killer in this country. So I'm really passionate about it. When we talk about what else, we want to reduce our sugars. Sugars are big evils. Everybody thinks that fats are bad. Yes, they are bad, but sugars are just equally as bad. Why? Because it's going to promote increases your risk of diabetes, of high blood pressure, of cholesterol, of cardiovascular disease, peripheral vascular disease. Those are all things that we need to be aware of. Then we talk about my passion, which is exercise. It's recommended that we all undergo 150 minutes a week of mild to moderate exercise. What does that mean? It means not taking a walk on our phone and putting in our earbuds and talking. If you're able to talk and walk, you're not exercising, in my opinion. Exercise means we want to stress our body. We want to give our heart a good workout. We want to get our heart rate up. We want to get our metabolic rate up. We want to use our muscles and tendons. We want to strengthen that. Why? Because we know with adequate exercise, it's going to promote good circulation. Okay. And we talk about circulation to our vital organs. People think that most of our vital organs are here within our chest and our abdominal cavity. We forget about this. Our brain is north of the border. Well, guess what? If you want your brain to work, which I want my brain to work every single day, and so do my patients, we need fresh oxygenated blood. So it's really important. How do you do that? Well, you're going to do the best way to do that is exercise. The more you exercise, the better carrying capacity you're going to have in your oxygenated blood, and it's going to get to your brain. In addition, diet. Well, we talk about what are we eating. If you're eating diet and high fat and high sugar, it's going to shunt blood away from our brain to our gut so that it can digest. That's the last thing you want to do after having your meals, having a lack of blood supply or decreased oxygenation to our brain because it's not going to work as well. I think it's vitally important as we get older to understand this, not only from the cardiovascular benefit, but to brain power and brain function, and also energy levels. One of the most common things I hear about it on a daily basis is, I wish I had more energy. Well, the way to have more energy is to increase our endorphins. How do you increase your endorphins? How do you increase circulation? It's by exercising. So I think that it's important, and it's important to realize that you need to make time. Most of us are very busy, including myself, with our schedules, and we need to make time for it. The most effective way to do it is put it in your schedule. If you know you have a meeting at 2:00 every Wednesday with your team at work, you're not going to miss it. Well, exercise should be no different. Put it in your schedule. If you put it in your schedule, you're not going to miss. It's coming up. Well, we've right upon respiratory season, cold and cough and flu. So some major tips. Number one is personal hygiene, making sure if you're around people, hand washing. Hand washing is key. If you shake somebody's hand, make sure you wash your hands afterwards. Don't shake somebody's hand and start eating because it just can be possibly transmissible. Also, making sure you're hydrating. Hydrating well is very important because if you do come down with a cough or cold or a virus or bacterial infection, you need to be able to fight that off. Proper sleep. We need sleep to be able to fight off any cough or colds or respiratory infections. So making sure, ultimately, ideally, if you can get 8 hours of sleep a night, that's a good start. In addition, we want to make sure that we are getting our flu vaccines. It is flu season. It is recommended that all people greater than one get flu vaccines. It's for that reason that if we do get the flu, it's not nearly as virulent, it's not as dangerous, and it's not as transmissible if we did not have our vaccines. If you're a type of person that doesn't want a vaccine, there are plenty of people out there that don't, and I understand and respect that. We just make sure, if you're common sense, if you're not feeling well, stay home. Stay home. And if you have to go out, wear a mask, not to protect you, to protect others. Simple things, very simple things. If you have a fever, stay home. What's the rule? 24 hours without a fever, then you can go out. It is also it's ending in October now, so that's the end of Breast Cancer Awareness Month. We want to make sure that we tell our women ages 50 and above for sure. A lot of women are trending 40 and above to get their annual mammograms. Very important. Why? Breast cancer is the number one cancer in women. We want to make sure that we can do everything possible that we can do to prevent early onset and detection with mammograms. Current statistics is 1 in 8 women will get diagnosed with breast cancer, which is 12.5%. If that doesn't strike a nerve, then I don't know what will. So we talk about female health. We talk about taking care, making sure you're up to date on the pap smear every 2 to 3 years. Also encouraging menopausal women to be updated on their bone density. Why? Because of osteoporosis and osteoporosis prevention. So there's a lot of things we talk about with that. Moving on to November, which is next week, is prostate cancer awareness. Prostate cancer is the number one cancer in men. Equally as important to women with breast cancer as men with prostate cancer. It's important to take a detailed family history. Do we have any male relatives in our family with a history of prostate cancer? It's very important. If you're a minority, very important. Why? It's a higher risk in minorities than including blacks and Hispanic males than it is in white Caucasians. Awareness and education is really important. Checking your PSA. PSA is prostate-specific antigen. It's a blood test that should be checked every year over the age of 50. My patients, I start checking in 40s. Why? Because unfortunately, I've seen prostate cancer in men that are in their 40s. And it's a very treatable disease if caught early enough, and really no excuse not to screen for it. So we talk about prostate cancer screening. We talk about taking a detailed history. We talk about educating men that don't be afraid to go to the doctor and get checked, because it is the number one cancer, and we want to do everything we can for either early protection or preventative measures in that realm. Thinking, what else can we talk about briefly? Annual physicals, which I spend a lot of time preparing for, and I spend a lot of time with my patients going through. I think first and foremost is a detailed history. You have to get a detailed history if you're going to be equipped to take care of a patient and make good medical decisions for them. So taking a history, whether it's their past history, surgical history, or family history, social history, diving into some of their habits, whether they're good habits. Some of us have poor habits, but those poor habits can be changed. And then talking about what can we do. I think most patients don't want to be on medications unless they absolutely have to be. So properly going through preventative measures, preventative steps, whether it's annual blood tests, which should include a CBC, which looks at your red blood cell, white blood cell, and platelet count. a metabolic panel, which looks at a fasting blood sugar, which looks at your kidney function, your liver function, your electrolytes. Also, like we said, prostate in men, thyroid should be evaluated, your urine, vitamin D, because there's a large percentage of especially women who are vitamin D deficient. We also check, obviously, very important to go over lipid profile. And I think it's not sufficient enough just to check your cholesterol and make a determination of whether you have high cholesterol and need to be treated just based on a simple lipid profile. But I think it's important to look at the overall patient, whether it's their other cardiovascular risk, whether it's their other cardiac markers that can be tested, including apolipoprotein B and lipoprotein little a, and a cardiac C-reactive protein, taking that all into account, along with their family history, their exercise regimen, and ultimately making a better conscious decision on if any treatment needs to be made. In addition, we also check in, typically should be checked as a hemoglobin A1C. A hemoglobin A1C is a blood test that tells us the average blood sugar over a 90-day period. And I can't tell you on countless times that I've seen patients with fasting blood sugars that are normal. And if you don't check that A1C, that 90-day average, you could miss prediabetes. And knowing and being able to educate somebody on a pre-diabetic condition can ultimately prevent them from becoming a diabetic. I think there will be a definitive role with AI in medicine. I'm hoping, especially in primary care, that it does not overtake the personal aspect of what we do and how we diagnose and how we treat patients. Because I think the true core of primary care medicine is developing that personalized relationship, as opposed to some other specialties or subspecialties. It's not as important, but I think we are at the true root of what we do is being able to establish good relationships and rapport with patients. And I would hate for AI to replace that. I just think there is a role with AI in helping us with advancing our medicine, advancing our technology. But I think it's going to be a very interesting thing to see how it's actually placed in primary care. I was actually did not like that years ago, and then I totally transformed and I embraced it, because to me that's showing a patient is actively engaged and involved in their healthcare, and whether they're right or they're wrong, we want to make sure that the more interest they have, the more that they can show that they are engaged in their healthcare, the better they're going to take care of themselves. So I have no problem with that active discussion with whether it's a search or an AI, because what I do tell patients is that, you when you're searching something, it doesn't mean it's you. Okay, so it's an option, or what we call differential diagnosis. But then I think that's when the discussion is really paramount to have with your provider, to say, hey, these are what I found, and these are what could be the causes, but it may not necessarily pertain to me. So, and I think that's where the medical training of your provider, your physician, your practitioner really comes into play, because they're helping you to narrow down that differential diagnosis and really figure out what tests and what diagnostics need to be run so that we can include or exclude those causes or etiologies. I feel fortunate enough to be able to practice what I preach, diet, exercise, leading a healthy life, and because it allows me to be a better practitioner, allows me to be a better physician, because I know the days that I exercise, I am feeling much more mentally sharp than days that maybe I can't, or days that I have a better night's sleep. I wake up feeling sharper and I feel more energy. Knowing what I eat, diet, I always say is what you put in is what you get out. If you put garbage in, you're going to get garbage out. What does that mean? That it's our bodies. Our bodies know if something good is coming in, it's easier to digest, it's easier to process, as opposed to if there's something that is what I term garbage. And it's much harder to eat healthier than it is to eat unhealthier. So you have to make the effort. But I can tell you that it's easy for me to sit and talk to a patient and counsel a patient on these things because I have the effects of it. I feel it. I know the importance of exercise. I know the importance of putting it in your schedule, whether it's waking up at 4:30 or 5 o'clock in the morning and getting your workout in before your day starts, or figuring out a time during the day or at the end of your day. You have to put it in. You have to prioritize. And I think your health and your health maintenance is a priority. And if you don't consider a priority, eventually it's going to catch up to you where you're not going to be able to necessarily what I call practice preventative medicine, but you're going to be practicing secondary prevention, which just means you already had a problem. And I always have a saying, it's much easier to prevent than it is to treat. I just think seeing the appreciation of the patients with regards to um, having spent a lot of time with patients, answering questions, and them feeling satisfied with their visits and with their care, as opposed to feeling like they were slighted or didn't have enough or didn't get what they expected. And I think there are, there are no expectations in the DPC model because I think that they're wide open, as opposed to maybe beforehand feeling that you can't accomplish everything you want to, because ultimately you can accomplish whatever the patient's needs are. And if they don't have needs, then you talk about all that topics, just education, because education, I think, is paramount in medicine, because the more education our patients have, the better equipped they are to take care of themselves. I'm hoping that more people jump on the bandwagon that I have decided to do because it's rewarding. You're able to practice medicine as opposed to staying in corporate large settings where it's harder to practice. I'm not going to say you can't, but it's there's other factors involved and there's more restrictions, shall we say. So I'm hoping that younger physicians come out not thinking that's the only way to go in is with a large group or go in a hospital system or in a corporate world type of environment, because it's not. It's really not. But we have to be open minded, and people have to understand that there's the changes is undergoing, and I think we are changing for the positive.